Hello everyone and welcome to scardia.com. I'm your educator Dr. Ali Imran, and today we're going to learn about EENT imaging. EENT stands for ear, eye, nose and throat imaging. Now these are the topics we're going to learn in the lecture. We're going to learn about the importance of imaging in sinusitis. Now, usually we do not do imaging in sinusitis, but there are certain conditions which do lead us to do imaging. What are those? We'll cover that in our lecture. Next, we have neck lumps. Now, it's a very important topic. Neck lumps range from thyroid nodules to lymph nodes to parotid swelling. So, it's an important topic and we will be covering it. Next one, we have the facial droop, or otherwise called the Bell's palsy. It is one of the most famous and common cranial nerve abnormality in human beings. So I'm looking forward to studying that with you. Next, we have the dysphagia and sore throat. We're learning about how dysphagia occurs, how imaging can resolve both in the diagnosis and treatment. Then we'll learn about visual problems and hearing problems. We learn about that not only physical exams help us in the diagnosis and treatment of visual and hearing problems, but radiology also helps both in the diagnosis and in the treatment of these problems. We'll learn about vertigo and tinnitus. Now these again are very important and need to be learned, and a good doctor must have very good grasp of them. Next, we have facial trauma and temporomandibular joint. Now, facial trauma is something every AEE doctor or accidents and emergency doctor must know and know how to proceed with it. Which trauma should be imaged first and which trauma should be dealt first. Now, this is a very critical choice, and through its understanding that we can make such a choice. Next, we'll learn about the carotid artery disease. Now, carotid artery disease is the leading cause of strokes in humans worldwide. So it's very important to learn about the carotid artery disease, why it happens, why imaging is involved in it, how it can help us in both diagnosing it, both resolving it and maintaining the position that it does not happen to anyone. We'll learn about it in more detail during the lecture. So that was all, folks, for the outline. You can join thiscardia.com for more videos on a variety of topics, from histopathology to virology to pulmonary medicine and everything in between. So I look forward for you all to visit scardia.com. Thank you so much for watching. You can also get complete access to all the lectures on the website. Thank you so much for watching.